Now, come Thursday, September 27th, the government of the Republic of Congo says it will begin a robust and coordinated response against the yellow fever outbreak recorded in some parts of the country. This follows the health ministry's warning last month on what he called an emerging event of epidemic proportions. According to the head of the government's epidemics unit, Lambert Kitembo, 186 suspected cases have been detected this year, many of which were in the western commercial hub of Pointe-Noire.
The yellow fever virus, sometimes deadly, transmitted by mosquitoes, causes fever, aches and nausea, and can quickly spread in areas with high unvaccinated population. The outbreak in Congo is not the first in the region and is not the first in the Central African region. In 2016, a major epidemic in Angola and the DRC killed more than 400 people and infected thousands more before being contained through a massive vaccination campaign.
Vaste campagne de vaccination.
Alexis Moyoka is the director of the expanded program of immunization at Congo's health ministry, and he is with us now. Thank you for joining us. Bonjour, monsieur. Please, could you tell us what is the plan to respond to and curtail the yellow fever epidemic in the country, in Congo?
Effectivement.
Indeed, the response plan against the yellow fever epidemic that was declared on August 24, 2018 in Pointe-Noire includes a reactive vaccination campaign in the department of Pointe-Noire that has been affected by this epidemic. Since the Pointe-Noire department is an urban department, we thought and convinced the partners, the regulatory authorities first of all, that we could not limit this campaign to the Chiambazi Health District, given that we are in an urban environment and that the population circulate in this department without limits. We decided to do this reaction throughout the Pointe-Noire department, and it will naturally even affect some border areas with the Kwilu, given the intertwining of the two departments. So, as we speak to you, we have received 1,200,000 doses of the yellow fever vaccine, which is a yellow fever vaccine here in Brazzaville. And the vaccines were immediately sent to Pointe-Noire, where they safely packaged under the expanded program on immunization, which is in Pointe-Noire.
Mr.
Moyoka, who is affected by this vaccination campaign in Pointe-Noire? This campaign concerns the entire population of Pointe-Noire department, except children under 9 months of age. We would like to point out that the yellow fever vaccine is a vaccine that has already proven its efficacy and safety. That is, it is effective against yellow fever and does not pose a risk to the population. This is why even people who have recently been vaccinated against yellow fever can be vaccinated. So there is no risk in receiving this vaccine. There are only advantages. And the biggest advantage is that since we are in the field, this vaccine, which is part of the expanded program on immunization vaccine, which is given free of charge to children between 0 to 11 months age group, given that it is an epidemic, we have expanded the target, as I said, to the entire population of Pointe-Noire. And those who did not receive the vaccine during this campaign must remember that if they travel, they will have to buy it at the pharmacy. But for this campaign, in response to the yellow fever outbreak in Pointe-Noire, this vaccine will only be free during this 6-day campaign.
Just to highlight some of the information that you've just shared on the planned response, the immunization campaign will last 6 days, and you say it will be available to the entire population of Pointe-Noire. But again, why has the planned response taken nearly a month to begin? The epidemic was officially declared on the 24th of August, and you are just about to address it on September 27th.
I must say that the government has acted accordingly since we had this case. In principle, from the declaration of the epidemic to the implementation of a reactive campaign, the prescribed time limits are 3 weeks. You will understand that we could not say that we were brilliant by the delay, but rather we must acknowledge the leadership of the Minister of Health and Population, who ensured that as soon as the case was confirmed, Congo could not hide its face, that the epidemic was clearly declared 3 days later, and at the end of September, it had already obtained agreements in principle to dispose of vaccines from UNICEF's supply division in Copenhagen, thanks to the support of the WHO, which made it possible to make them available by identifying the doses, because they must be reserved. It is not enough to say that we intend, and it's not easy to unlock 1,200,000 doses of vaccines in such a short time.